Thank you, Mr. Chairman and members, for the opportunity to lay out House Bill 3174. House Bill 3174 is a critical public health and public safety initiative aimed to addressing the spread of blood-borne diseases in Bexar, Dallas, El Paso, Harris, Nueces, Travis, and Webb counties. House Bill 3174 would allow these 7 counties to establish disease control pilot programs that would, 1, connect people with healthcare, substance abuse treatment, and testing. 2, offer education on the transmission and prevention of infectious diseases. And 3, provide access to sterile needles and safe disposal options to prevent contaminated needle injuries. Studies have shown that access to clean needles dramatically reduce the transmission of diseases like HIV and AIDS, hepatitis B, and hepatitis C. According to the data from the dishes, syphilis cases among those who injected drugs doubled statewide and tripled in Dallas and Harris counties between 2020 and 2023. HIV infections rate rose in each of the selected counties, while rates declined in Bexar County, where there is a syringe exchange program. These programs work, members, and not just in Bexar County. Kentucky implementations of similar programs resulted in a 6% annual decrease in HIV and hepatitis diagnosis and increased testing rates. Syringe needle exchange programs are also a crucial part of any plan to effectively combat the opioid epidemic, which claimed the lives of 2,919 Texans in 2023. This is because these programs deserve a bridge to treatment by connecting people who inject drugs with services and providing overdose education. Syringe programs do not encourage new drug use. Let me say that again. This program will not encourage new drug use or increase drug use among existing users. Studies show safe syringe program users are 5 times more likely to enter treatment and 3 times more likely to stop using drugs than non-participants. Members, let's keep Texas safe. It helps protect children from finding discarded contaminated needles. It shields first responders from accidentally needle sticks and offer pathways to recovery for those struggling with addictions. And so, with that, members, I thank you, and I reserve the right to close. I will answer any questions, but I do have some experts there who will probably give you a better answer than I can.
All right. Thank you, members. All right. Representative Lowe.
Hi, good morning. Thank you.
Good
I
morning.
think this is an interesting topic. Okay, so I was prescribed needles for a while for an illness, and they gave me a sharps container. You know, you could put like X number of needles in there.
Right.
So then I take it to this exchange place. You're not supposed to open it up. So how do you know how do we actually make sure that, is there going to be like a chain of custody? How is this whole thing going to work? Like, beyond, I've read the bill, but like,
Yeah.
they get them, and then the taxpayers are now on the hook for destroying the needles, or how does this
You
work?
know, Mr. Lowe, when y'all say the taxpayers, y'all act like it's only certain people that pay taxes. Everybody pay taxes, so I don't know why y'all do that, but everybody pays taxes. It's not just a certain party who pays taxes. Everybody in the state pays taxes, so therefore everybody should benefit from those taxes. Let me just first say that. But this would be up to the counties to create a program that would and I had it out. I have a sample of one of the things that we were gonna do. Okay, so it would be up to the counties to create these programs. And like I said, I have an expert who actually knows it. That's why I said it would be better to let the expert, because I don't want to just make a statement and of how it works. I had it, wait a minute. Yeah.
Well, I will say that every additional program that we creates new taxes, more costs. And so I think it's important that we're fair and we're honest, this will cost taxpayers additional money.
No, there's no fiscal note on this bill, right? Right, we don't have a fiscal note on this bill.
Doesn't mean that-
It can be utilized with existing resources, but again, we can't just focus on taxpayers, certain taxpayers. You gotta focus on certain taxpayers. If you're gonna be for here and represent Texas, you can't just represent your district. You have to represent all Texans. And so therefore, taxes should be utilized. If it's gonna be something that's gonna combat an issue that we have in our state, I don't understand why that's an issue if taxpayer funds are used towards that. We don't have a problem giving big businesses money. We don't have a problem doing all of those, but we have an issue when it comes to the quality of life issues for people. And I just don't think that that's fair. Because to me, that's what government should be about, worried about quality of life issues for people. All right.
All right. Members, any other questions? Representative Rose, I did notice, number one, it looks like your bill is that the commission, or that the districts or counties can do it. It's permissive. They're not required to do it. Is that correct?
Right.
If this passes, they're not under any obligation. They can either
Right.
create this program or not.
Exactly.
And it looks like it's limited to Bexar, Dallas, El Paso, Harris, Nueces, Travis, and Webb counties, and the hospital districts in those counties. Is that correct?
That's correct.
Okay. Members, any other questions?
I got a quick one.
All right.
So
Chairman
let me
Dever.
just say this first, Mr. Chairman. Okay, again, it would be an anonymous exchange of needles for clean ones for and then also provide education, prevention, and connect participants with healthcare and substance abuse. You know, I try to tell y'all, Texas is not a one-size-fits-all state. Just because it's not happening in your community doesn't mean it's not happening. These counties that we have listed are the counties that have been impacted the most, and that's why we've limited to those counties. But again, we can't be here to just represent our districts. We have to be here to represent all of Texas.
Right. All right. Chairman Tepper.
So Representative, I've seen these programs before and the type of counties I think you're talking about. What does this change exactly? I've seen these programs out there already. They already exist, I think.
But they exist where? Now, Bexar County
Certainly-
has one
certainly
because there was
Travis
a
County.
pilot program done in Bexar County, and you can see, as I said, they've seen a 6%.
There's drug needle collections all over Travis County.
I'm not aware of those. Where are they?
Shoot, right on I-35.
Not today, Mr. Tepper.
Have they
not
gotten rid of
today,
them?
Okay, because I'm not today. Not today. Not today.
Thank you.
I mean, yeah, yeah. You see, again, we can't just be worried about our own communities. You have to be able to address the issues that will
Well,
help
I don't live in
decrease
Travis
those
County,
problems.
and I didn't notice, I did notice the drug needle collection. I wasn't imagining it, I'm not lying. I saw drug needle collections on I-35 and different other parts of town.
But it wasn't an exchange program. You may have seen them collected, but it was not an exchange program.
And so these are not currently in Harris or Dallas County, this program?
That's correct.
Okay, thank you.
Thank you.
Members, any other questions? All right, we will let you close shortly, and I think we got some witnesses registered that you would probably love to have them answer these questions. All right.
All right.
Thank you very much.